tool that I decided to do for this video is the nutrition assessment tool, and the one that has been deemed most beneficial in determining malnutrition is the mini nutritional assessment, or MNA for short. The age to consider someone an older adult is anyone over the age of 65. The patient I will be using throughout the semester for this class is actually my dad. He turned 65 last June, and he also has type 2 diabetes as well as hypertension, which were diagnosed within the last 5 years. Malnutrition is often confused with undernutrition, but is understood to be anyone with a BMI less than 19 or a BMI higher than 25. I chose this tool as my dad is 5'5" and roughly 200 pounds, which would put his BMI at 33.3. And since he also suffers from hypertension and diabetes, I thought this assessment tool would be pretty beneficial to see how well his nutrition is. So to start with the actual assessment, it is a questionnaire and it consists of 2 sections. So section 1 is a screening, which you ask them a series of questions and the patient has to rank them and their numbers basically, and then the numbers are added together, and if they score less than 11, it indicates an issue with nutrition, meaning they need to continue with the assessment. So as I pull it up, the screening questions are A through F. So A is, has food intake declined over the past 3 months due to loss of appetite, digestive problems, chewing or swallowing difficulties? The patient then will choose 0 for severe decrease, 1 for moderate decrease, or 2 for no decrease noted. My dad chose 2. B is a weight loss during the last few months, 0 being a weight loss greater than 3 kilograms or 6.6 pounds, 1 being they don't know how much weight they've lost, 2 being weight loss between 1 and 3 kilograms, which is 2.2 to 6.6 pounds, or 3, no weight loss noted. My dad put 3 for no weight loss noted. C is mobility, 0 being that they are bed or chair bound, 1 being that they're able to get out of bed or a chair but they don't go out, or 2 being they go out. My dad put 2. D, you ask if they have suffered psychological stress or any acute diseases within the last 3 months. This one's super simple, it's just 0 for yes or 2 for no. My dad put 2. E is neuropsychological problems, 0 being severe dementia or depression, 1 being mild dementia, and 2 being no psychological problems noted, and my dad put 2. And then F is a body mass index, and this one is 0 being a BMI less than 19, 1 being a BMI that's 19 to 21, 2 being a BMI of 21 to 23, or 3 being a BMI 23 or greater. My dad, being a BMI of 3.3, put 3 as his answer, and he actually scored over a 12, so that means he is not at risk and he does not need to complete the assessment. But for the purposes of this video, I will explain the rest of the assessment. So it first starts off with just 3 simple yes or no questions that again are ranked in numbers, and these are like 1 and 0. So the questions that you ask are, do they live independently, not in a nursing home or in a hospital unit? Do they take more than 3 prescription drugs per day, or do they have any pressure sores or skin ulcers? Next, you would continue with the assessment and ask how many full meals they eat daily, 0 being 1, 1 being 2 meals, or 2 being 3 meals. Then you would ask their selected consumption markers for their protein intake, and these are simple yes or no questions. So you would ask them if they have 1 serving of dairy products per day, 2 or more servings of legumes or eggs per week, or do they consume meat, fish, or poultry every day? Next, you ask, do they consume 2 or more servings of fruits and vegetables per day, 0 being no, 1 being yes. Then you would ask how much fluid they intake, and then their mode of feeding, whether they're unable to eat, whether they can self-feed with difficulty, or whether they have self-feed with no problems. You also ask how they view themselves and their nutritional status compared to other people. And then you would measure their mid-arm circumference, their calf circumference, and then you would add up all of their scores through these ranking numbers, and a score of 17 to 23.5 is they're at risk for malnutrition, and less than 17 means they have malnutrition. And some additional questions that I would include would be, could you tell me how much exercise you perform daily? Do you ever find yourself skipping meals? How often do you have a home-cooked meal? Do you find yourself uncomfortable with your body weight or image? And what foods do you find more appealing than others? Thank you.